So do you know someone, or do you yourself suffer from numbness and tingling in the thumb, index, middle, even half of the ring finger? If so, you could be suffering from what is called carpal tunnel syndrome. What if I told you there was a pretty simple and easy taping technique that could potentially reduce some of those symptoms and help decrease that numbness and tingling? Or are you a therapist treating someone for carpal tunnel syndrome conservatively, and thus far none of the conservative measures have been successful in reducing their symptoms? Then follow these simple techniques of taping for carpal tunnel, and maybe use this as a last resort to see if this may help your patient. So all you'll need for taping for carpal tunnel syndrome is going to be 2 pieces of tape, 1 long piece of 2-inch tape, and you can see I've kind of made a little slit about 2 inches or so into one of the ends. You're going to have a very small piece that we'll put at the wrist and a pair of scissors. For this demonstration, we're actually going to be using rock tape. For some of our other taping videos, we've used KT tape. Again, this is just another tape that's out there, and there's even more than just those 2 as well. So whichever one works for you is fine. Okay, so taping for carpal tunnel syndrome. So first we're going to take our longer piece that we cut our small slit in on one of the ends. We're going to go ahead and tear both of those portions off. You can also do that one at a time if you're worried about them 2 sticking together. But essentially what we're going to do is tape, well, first we're going to have the patient kind of bring their wrist into extension. So you're going to have them over the edge of a table or over an elevation pad. All right, so you're going to take one of your ends, and you know, carpal tunnel is in this area. A lot of people get confused and think it's a little more proximal up in the wrist, but it's actually right as you enter the palm. So the idea behind this tape is to put one on the hypothenar side. That's really no stretch with that. You've just got the patient in extension, and you're going to put the other on the thenar aspect of the hand and thumb. Rub that in really good to activate that adhesive. And what we're doing here is kind of creating like a splaying motion, so it kind of opens up that carpal tunnel some, which would obviously relieve some of those symptoms, because that's essentially what carpal tunnel is. We're running out of room, and so that nerve is too compressed. So this right here just kind of helps splay that area, open that tunnel up just a little bit. Now what we're going to do is take the rest of that tape, take all of that off except maybe an inch or so you can have something to pull with. And again, make sure their wrist is in good extension. You're going to pull basically right up that forearm up towards that medial epicondyle. The last inch or so of your tape is going to be no stretch, and the tape that's going down the length of the forearm, really not a ton of stretch there, maybe somewhere around 50% or less. Really rub that in. Make sure it's sticking really well to them. And then you're going to take your smaller piece, and this piece is optional. You don't necessarily have to do this, but it will kind of serve as a decompression tape. You can't really get over the carpal tunnel, like we talked about earlier, is actually here, because if you put that tape there, it's just going to get all bunched up when the patient or yourself starts moving around and using your hand. So we usually put the decompression piece of tape right at the wrist, or just proximal to the wrist. So we're going to take one piece or one side off. Going to apply that tape on really either side, doesn't matter, radial or ulnar. And going to put pretty good stretch on that one, 50% or even more. Really rub that in. And there you have it. So that tape kind of creates a lifting effect to that carpal tunnel, so it can hopefully relieve some of those symptoms that your patient may be having. As always, this tape can be worn for a few days, even through showers and getting it wet. If your edges start rolling up some, you can just have the patient or yourself again just kind of clip those edges and lay them back down. Usually you get a few days wear out of this. Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So you know our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.